I'm here with Amanda, and how many weeks gestation are you?
I am at 35 weeks today, actually.
35 weeks, okay, and this is your second pregnancy?
Second pregnancy.
And then what are you feeling as far as like what brings you here?
I'm having a lot of like tightness and I feel very heavy and like a lot of weight pulling here that I think is making my back very tender and very tired.
Okay, so we will work on like the back and the hips, and so here I am spending a lot of time working on her back, on the tight muscles, and you'll see I make a funny face when I feel something tight. We spend a lot of time on this, but I really condensed it down, so it's kind of boring to watch. This is our pregnancy pillow, so moms can lay on it with their belly.
We'll do some stretch. That's so good. I felt like my upper back got released.
This is unscripted. And then here I'm going to show her our first exercise is rocking back and forth on your hands and knees. And she kind of makes some adjustments. It's a good way to stretch out the lower back. Just gently back and forth. And now she's going to hold it here. Now she's going to hold it into child's pose. Get a nice stretch of the lower back, and then bring our hands both to one side to get a stretch more on one side of the back. And then stretch to the other side. And now we're going to do some cat-cows. So some of these exercises might not feel good if you're pregnant because of the weight of the baby, so depends on the person. But if this one feels good, it's a good way to get some movement through the spine. And then here we're doing what I call hug the baby. So she's engaging her abs so they're relaxed here, and then she engages her abs to pull the baby, hug the baby towards the spine. And this is a good abdominal exercise in pregnancy. And again, if on your hands and knees feels not good, we'll show you some other positions you can do this exercise in. And now on the ball, we're rocking back and forth, and she's really trying to get movement from her hips and pelvis. Back and forth, and she also is telling me that she feels it in her abs, and you can look and see the abs engaging when she goes forward. And then they relax as she goes backwards. And then she's going to do some hip circles on the ball. This is another way to just get some movement through the lower spine, the hips, the pelvis, get everything moving. These muscles are working overtime as baby grows, and the lower back and hips can get really painful and stiff, so this is a good way to just get some relief. And now she's doing hug the baby exercise in standing. And if you look, she's using her breath. And she told me on her hands and knees was the easiest, but just want to show you guys a couple different options because everyone's different of what feels good in pregnancy. So really engaging those abs and letting it go. And then she's doing the same exercise sitting and engaging the abs and relaxing. And she's using her breath with it. And she told me this one was the hardest. And if you look at her body, she looks kind of like compacted here. There's nowhere for a baby to go, basically. But she was a good sport and demonstrated it for us. And this exercise I give to everyone in pregnancy to stretch the back of the hips because always these muscles are tight. I've not had a pregnant patient yet that didn't feel good with this exercise. And everyone's a little asymmetrical. No one's the same flexibility on each side. So just go to your comfort zone.